viewers. Sorry for the delay. There was some technical glitch today. In fact, thank you for taking your time out to watch Facebook Live session on primary prevention on breast cancer. I'm Aru. Today, I'll be moderating Facebook Live session. Our goal is simple: to raise awareness on breast cancer to every family out there. Let me introduce you to the patient's most favorite and renowned surgical oncologist, Professor Dr. S. Jagadesh Chandra Bose. Dr. Bose has more than 30 plus years of experience in his field. He is currently practicing at VS Hospitals, Chennai. Dr. Bose performs even the most complicated cases with ease, with a high success rate in performing various procedures with high precision and accuracy. Dr. Bose believes in healthcare that is based on a personal commitment to meet patient needs with compassion and care. Welcome to Facebook Live session, Doctor. It's an honor and we're always excited to listen to you.
So thank you, Arun, for your nice introduction, and hello viewers, and I am glad to be associated with VS Hospital in this nice day. So what we call as a Breast Cancer Awareness Day. So it is nice that I think even though we had some technical problems, we are able to be live and to share our views with the viewers and to have some queries answered, right? So thanks, Arun. Let's go ahead.
That's great, sir. Doctor, to begin, what exactly breast cancer is?
Okay. So now you know that breast cancer is something like an epidemic. So the disease has become so very common that everybody talks about breast cancer. And this month, especially the October, is associated with the breast cancer awareness. And world over, you know, people talk about this disease so much that even though it affects only predominantly the female population, which contributes to only 50%, this is the commonest cancer worldwide, right? So if you take the worldwide population, the breast cancer is the commonest cancer. So that is why this cancer becomes most important, right? And so breast cancer as such is arising from the glandular tissue of the breast. So even though this disease is very common, 9:1 is the ratio between male, that is the female to male, the ratio is 9:1. It is just an abnormal growth of cell which happens in the glandular tissue of the breast. So this can affect two parts of the breast. One is the ductal system, when we call it a ductal cancer, and the other one is the lobular cancer, which affects the lobules of the breast. So it is basically an abnormal growth of cells which affects the glandular tissue of the breast. And this breast is nothing but something like a sweat gland, which is derived from the skin, right? And that is what is breast cancer basically about. Yes, Arun, thank you.
Yes, that's interesting, doctor. Thank you for educating us. Doctor, every family should be aware about breast cancer.
Yeah.
Can you please educate us?
Yeah. Now, this awareness basically, or the education about breast cancer, is very important basically because of three main reasons. One reason is it can reduce the incidence by avoiding the risk factors which can lead on to any cancer, right? So that is the most important thing. So that is called as the primary prevention. So when you prevent the breast cancer from happening, you know that you avoid being sick of the breast cancer. So that is the most important thing any doctor should think. Because instead of treating a patient, we would like to avoid the breast cancer from happening. That is, reduce its incidence of breast cancer. So that is the primary idea of creating this awareness so that people understand the risk factors, avoid the risk factors, and be free of the disease. That is the primary prevention. The next awareness comes from improving the survival. So if you detect the disease early, you know that you can improve the survival of the individual. So rather than people presenting very late, where you know that the disease has its own mortality and morbidity. So you can treat the disease very early and you can survive much more, right? So that is the next awareness. The third most important thing which I wanted to stress is acceptance. So when you're aware of the disease, you accept the disease. And that removes a lot of social stigmas. So if you're not aware, you don't accept the disease. You think, why should I develop the breast cancer? I'm such a nice person. Why should I develop the breast cancer? Right? Such problems or the social stigmas should be taken away from this disease. When you're aware, you know that you accept the disease and get treated better. So these are the three main reasons with which the cancer awareness or the breast cancer awareness should be there among people, right?
That was very informative, doctor. Can we move on to the next question, doctor? Can a healthy diet prevent breast cancer?
Right. See, we know that in 1975, the disease was affecting only 1 in 25 women. Now it has become so very common that it's almost affecting 1 in 10 women in the world, right? So why is it so? Because we are changing our lifestyle. We are changing our diet. Gone are the days when people used to do good amount of physical activity. And I can even say that if you take a picture, which would relate to 30, 40 years back, with some people standing in the bus stand or a common place, you would see a lot of people are very thin, right? And they are not this very obese or overweight. So if you just compare a picture which you take in a common place now to one which you would have done about 50 years or 30 years back, you would see that the lifestyle and the people, their entire habitus has changed. So people have become more obese. Their physical activity is very, very less. So there are some definite risk factors which are relating to the lifestyle and diet. The most important thing being overweight or obese. Now, how does this really affect? So people should understand that obesity can cause two important things. One, it can increase your insulin level. And because of the high carbohydrate in your diet, we take a lot of processed food, right? So we take cooked food or processed food, which are very sweet, nice, that contains a lot of carbohydrates. And these carbohydrates get converted into fat in our body and cause what is called as a central obesity. This central obesity produces a lot of fat in and around the hips. And this can get converted into hormone, that is the estrogen. And this is called the peripheral estrogen. So the high insulin content in the body and the high estrogen, which is produced from the fat, are the primary reasons for the increase in the breast cancer incidence in the recent years. And I can add on to say that we are getting nowadays a type of cancer called the triple negative cancer in the premenopausal women, basically because of the obesity. And the hormone dependent cancer in the elderly, which is also because of the obesity. So that is one of the most important factors. The next factor is women are also taking into alcohol. You know, alcohol, if you take a very small amount, it can increase twice. But if you take something like 2 or 3 drinks per day, it can increase the risk by 20%. And the other thing is not being physically active. Somebody has to do 300 minutes of physical activity every week. So if you don't do 300 minutes of, something like moderate physical activity, like walking continuously and things like that, if you don't put in 300 minutes of physical activity every week, you know that you are going to be one among the factors which would play as a high risk factor for the breast cancer. There are certain unclear factors like high fat diet, dairy products, tobacco smoke, chemicals like pesticides, right? So these are all, and the night shift work, which people are taking up much more now with the software industry. So you would see that because of the night shift, our hormones in the pituitary, like melatonin and the hypothalamo-pituitary axis, are affected. So these are some unclear factors, but however, we know that our lifestyle has definitely changed the risk factors for the breast cancer to the higher end. And so that is why there is an increase in the breast cancer incidence, right? So definitely lifestyle and diet has got a role to play.
That was very elaborate. Doctor, my next question is, how can a woman determine her risk?
Right. So that's a very good question. So you know that every woman should understand the risk factors. Now there are certain unchangeable risk factors. Being born a female is a risk factor. Because as I told you, 9:1, the incidence of breast cancer is there in the female. And being elderly, that is more than 55 years of age, is again a risk factor. And there is, of course, familial history. What we mean by a familial history is 2 first-degree relatives are suffering from some breast cancer or related cancers like ovarian cancer, can add on to the risk. And there is always a hereditary risk factor. Now, the race, the dense breast tissue, benign breast conditions, all these are risk factors. And there are certain algorithms which are derived, where you have some calculated models called the Gale model, and so many models are there which are derived to calculate the risk of a breast cancer in a female. So it is always important that a female, when they reach the age of around 40 years, they need to calculate the risk and know how high risk they are in developing the breast cancer. So these models, what I told you, are available on the net. So anybody can browse in that, and you can feed in the information and get your risk analyzed. So if you fall into the high risk group, naturally any female should be aware that they have to go through all the ideas or some physical examination, the breast self-examination, all these they have to undergo. And nowadays, as you are asking about more about determining the risk, we have to know about the hereditary risk also, right? Thank you.
That was very informative, doctor. Are there ways to prevent breast cancer among high and low risk women?
Right. So the most important thing which I told you is risk stratification. So once you know that you are risk stratified as a high risk, now you have to maintain a healthy weight. You have to be physically active. You have to avoid alcohol. If you have a definite hereditary factor, you need to undergo a genetic testing. There are genetic tests which are now available, right? Yeah. And if you fall into a very high risk group, there are even medicines which can be given, which is called as a chemo prevention. So if you fall into a high risk group, you can take those medicines to reduce your risk. That is also possible, right? And there is always a preventive surgery. For example, if you're tested to be BRCA positive, you know about the Angelina Jolie effect, where you have the bilateral mastectomy done by Angelina Jolie to prevent the breast cancer. So you have preventive strategies. You can undergo preventive mastectomy, preventive oophorectomy to prevent the breast cancer from happening, rather than suffering from the disease after it affects you. So there are definite preventive modes, but the person should have first a risk stratification. So this risk stratification is very, very important. And based on that, they have to go through all these protocols, what I mentioned to you, right?
Thank you, doctor. Doctor, my next question. In fact, in common, most women tend to forget, to take care of their health. My question is, how often should the breast self-examination be performed?
Correct. Now, this is a very relevant question. See, why are we seeing breast cancer at a very advanced stage? Because women don't inspect their breast in front of a mirror. It's a very simple thing. See, our women are shy to stand before the mirror and see their breasts themselves. So it's a very, what shall I say? It's a very obvious fact. How many of us have a full mirror in our bathroom? We don't have it. So women don't see their breasts in front of a mirror. So the breast self-examination is a very simple thing to see the breast and detect a very early breast cancer. For example, if you see a small lump or a deformity in the breast, it can be picked up at a very early stage because breast lumps which are produced by cancers are not painful. Usually they are not very painful. So people come to us in a very advanced stage. So if all they have to do is to stand before a mirror and examine the breast, this is usually done on the 5th day of the cycle if the person is menstruating. And if the person is not menstruating, they should have some fixed day every month to stand before the mirror, especially when they are showering. It is easier to examine the breast. So there is a proper way to do it. So you'll have to do it in a clockwise manner by putting the palm of the hand and pressing it against the chest wall like this. If you do it like that, you will be able to see small lumps or deformities in the breast, which will help us to detect the disease early and do a treatment which can give them least morbidity. That is, you can even avoid removal of the breast if you come very early. And then you can have the best of the treatment so that you can survive long, right? So the 5th day of the cycle, if you are menstruating, and every month you have to inspect your breast and palpate your breast. And that is what is important. That's what is called as a breast self-examination.
Thank you so much, doctor, for educating us. Doctor, my next question is, who should be having breast screening or mammograms and how often?
Correct. So all women at 30 years, as I told you, can undergo this risk assessment score. If they have a hereditary cancer, definitely you need to do this at a very early age because the possibility of having a disease is very high. So they are classified as high-risk people. Otherwise, in the general population, we advise mammograms at 40 years of age, right? So 40 years of age, every year, you do the mammogram. If 3 consecutive years, you have a normal mammogram, you can do the mammogram once in 3 years, right? So till your life expectancy is about 10 years, right? So like, for example, till you reach about 75 or 80 years, you need to do the mammogram, correct? So ideal is to have the mammogram every year, correct? After the age of 40 years. So that is the general advice for the mammogram.
Sure. Doctor, should women panic if she finds a lump or any abnormalities in the breast?
Right. So it's generally a tendency, like everybody thinks all breast lumps are cancer. It is not true. Only 50% of the breast lumps are cancerous. The rest of them may be due to other benign conditions. Like, you can have something like a mastitis. You can have other benign conditions in the breast too. So the women did not panic. All they have to do is see, most often what happens, the woman panics and they don't want to go to the doctor. They think the doctor is going to say that it is definitely a cancer. So they are going to treat me with chemotherapy, radiation, surgery, and all that. So they are scared. They don't want to go to the doctor. But that should not happen. Every woman should be aware that when they detect a lump, 50% of them can be non-cancerous. So they need to go to the doctor, do the proper evaluation, and then find out what it is and treat accordingly. So by doing that, they are going to reduce definitely the problems which they are going to face in case they are going to neglect it. So neglecting a breast lump is more harmful than panicking it. So we have to definitely seek the doctor's advice when you see a lump in the breast. So you should not panic because 50% of the lumps are benign.
Thank you so much, doctor. Doctor, my next question. What are the right steps to detect breast cancer at an early stage?
Right. So there are 3 important steps. So the first most important step is be aware of the potential symptoms. You know that any abnormality in the breast, you need to seek an advice. Any discharge from the nipple, any pain in the breast, or any ulcer that does not heal. So any problems, you just seek, you be aware of it, of the potential symptoms. If you're not aware, definitely you're not going to seek the help. That is the first step. Next step, do a good self-examination. That is the breast self-examination. And the third thing is a clinical examination followed by what is called as a triple assessment, as we say. So you go to a doctor or a healthcare worker, get yourself examined, do a test called a mammogram or a radiological test to see whether you've got any lumps which are not palpable. And if necessary, do a pathology, that is a fine needle aspiration to confirm what you've got. So that is called the triple assessment: a clinical examination, a radiological test, and a pathological evaluation. So if you do these three things, that is being aware, breast self-examination, and a clinical examination, you will be able to manage this disease much more effectively. And you can do a good detection at a very early stage and treat the people with comfort, right?
This information is very, very helpful, doctor. Doctor, my last question. What is the take-home message about breast cancer?
Correct. So the take-home message is that only female people should not be aware. Even the male should be aware of it.
Very true.
Like that, what I am trying to say is every husband, every brother, or a father should take care of the family and the female population. And every employer should take care of his employee, in that they have to promote breast cancer awareness by advising them to do mammograms at a very early age and be aware of this disease, educate them regarding the breast self-examination. And the next important thing is just being aware is not going to be the idea. You have to take an action. What are the actions we want to take? First, you have to remove the stigmas. People think good people don't develop cancers. So they think, I'm a nice person. Why should I develop this disease? You have to remove that stigma. Say that anybody can have a breast cancer. So accept the reality and the disease and act in the sense, do early detection with mammograms. Educate the younger generation by going into the schools, educate them. And that is when, by taking an action, we can definitely go a long way in preventing the disease as well as conquering the disease. So we can prevent the women from losing their breast and detecting the disease early by taking good actions, by doing early detection and educating them regarding the risk factors so that they are free of this disease. So thank you very much.
This message will go a long way, doctor. Thank you so much.
Thank you
for your valuable time, and we apologize for the delay in conducting this.
Anyway, it was very useful, and thank you, Arun, and the entire team in VS Hospital, including Soumya. I think she has taken a lot of pains in this, but she was not able to be there. But yes, very nice of you. Thank you very much. Nice.
Thank you so much. Thank you so much. And thank you, viewers, for your patience and for staying with us for the last 30 minutes. To all the women out there, there's no need to panic. Breast cancer is curable if detected early. So don't ignore and get screened on priority. Oh, for women, everything is a priority. Get screened now. Take action. Coming Thursday, we have a Facebook Live session with the dynamic, energetic, loved, and adored by his patients, Professor Dr. S. Sundar, Senior Consultant, Joint Replacement and Tumor Surgeon, and Medical Director, VS Group of Hospitals. Dr. Sundar will educate us on osteoporosis. The topic is Don't Let Osteoporosis Fracture Your Future. And I'll be moderating the next live session. Till then, stay tuned. Take care.
Bye.
Thank you very much. Thank you, doctor. Thank you so much. Thank you, viewers.